Welcome to this video where we're going to explore pelvic tilting. This exercise to help switch off the extensor muscles of the lower back and can help with lots of things that contribute to lower back pain. It's a lovely exercise to have as part of a daily back care routine. So we're going to come into lying on our backs, lying on your back, and then let your feet come to find the floor. Let your feet, the back of your pelvis, your upper back, your shoulders, the back of your head and your arms all find the ground, and just let them be here supported by the ground. We start with finding our breath. So let your attention come to your breath. Notice it coming in and out. Try and direct it in and out through the nose. And as you inhale, try to send it really deep down into the base of your belly. So right down, almost into the bowl of your pelvis. As you inhale, imagine a balloon expanding deep within your pelvis, and as you exhale, that balloon contracts. And we'll start to focus on the exhale a little more. So as the balloon contracts, there's a sense of drawing in from the sides and also up from underneath. So inhaling to expand, exhaling to contract in and up. As that happens, there's a sense of drawing down through the ribcage towards the pelvis. Chest stays relaxed, the neck stays relaxed. So this is the first stage of the exercise. Breathe, find your breath, and as you exhale, draw up through the pelvic floor and in through the tummy muscles, slightly sucking the belly button back towards the front of the spine. And once you feel comfortable with that, you can start to bring some movement in. So as we exhale, we're going to find the space behind the lower back, and we're going to roll the pelvis backwards, which flattens the lower back down in towards the ground, closes down that space. So inhale to expand your balloon. Exhale, gently rolling the pelvis back by drawing the front of the pelvis up, and the tail reaches down along the mat towards your heels. Inhale into the belly to come back, open up the space and come back where you started. Exhale, drawing up at the front, down at the back. Drawing up and in through the pelvic floor and the tummy at the same time. Inhaling to roll forwards and open. Exhale, rolling back to close the space. So we call this pelvic tilting. You can take your hands onto the sides of your pelvis and feel the pelvis rolling backwards as you exhale and forwards again as you inhale. And we're really trying to work with deep muscles here rather than the more superficial ones, keeping, again, the chin, the chest, the jaw, the shoulders all relaxed. Breathing in and out through the nose. And once this feels comfortable and you feel confident with it, you can progress on to the next stage of the exercise, which is allowing a slight lift to the back of the pelvis. So as you reach the end of your exhale and you roll back, pressing into the feet a little more so the pelvis slightly lifts. So you could just about slide a piece of paper in underneath the back of the pelvis. And then let it land and come back to where you started. So we're coming back as we inhale, and as we exhale, draw up, draw in, roll back, gentle press, slight lift. Inhale to drop and come back to where we started. So that's the third stage of this, going from a pelvic tilt into a bit of a lift, and then we can go into a full articulated bridge. Inhale into the belly, exhale, drawing up and in, rolling the pelvis back, close down the space behind the lower back, Press into the feet to lift the pelvis ever so slightly, and then we gradually work our way up the spine. So we lift the pelvis and then the lower back starts to lift. But what we want to do is go one vertebrae at a time. And we'll go in one breath. So as we inhale, we come back to where we started. Exhale, roll back, close down the space, drawing up and in, slowly pressing up one vertebrae at a time. Inhale to come down one vertebrae at a time into the belly. Exhale, draw up, draw in, roll back, close down the space, press into the feet, lift the pelvis, and slowly rolling up one vertebrae at a time. And we keep going with this until we come to a point where our shoulders, our hips, and our knees are all just about in one line. It's about as high as we'd want to go. And this rolling up and down through the spine, we do as if we have a piece of Velcro stuck right along the back of our spine. And as we roll up, we peel from the bottom, and then the middle, and then the top, all one continuous line, and then we stick it back down again to the ground. So this exercise, you can work your way through the different stages of it over the course of a few minutes with the favourite piece of music on. It's a really nice way to warm up your spine for the day, to let your spinal extensor muscle calm down and switch off, to strengthen up your core and postural muscles, and to get your back vertebrae articulating beautifully with each other. Okay, enjoy.